Okay, it seems she's not back. She's not back yet. Let's wait a few more moments for her to come on board. Okay, I can see Dr. Maureen is back now. Dr. Maureen Wafo, we are waiting for you to commence the presentation.
Thank you very much. Hope you can hear me.
Yes, we can hear you, ma.
Okay. We thank God that we are back again. To the glory of God. I'm happy that this presentation is taking place tonight. The main aim of this presentation is for us to know more about critical care pharmacy, so that if you want to go into specialization in the specialty, you are sure of what you want. That's the main objective of today's presentation. I want to thank the Pan National Chairman, ably led by Dr. Joseph Imadu, and all the NEC, our committee, test officers who made it possible for us to have different specialty groups now, so that we can use that such forum to help ourselves get competency in different specialties. Once again, thank you very much for the opportunity given to me to make this presentation this night. Let me start by sharing the slides. Okay, hope you are seeing the slides.
Yes, we can.
Okay. Okay, today's topic, as we've been sharing, is an insight into critical care pharmacy practice from my humble self. These are the outline we are going to discuss this night. We are going to look at the overview of critical care pharmacy, overview of intensive care unit, that's ICU, The who is critical care pharmacist, the roles of a critical care pharmacy, and the requirements for certification in such specialty, which is a critical care. Then conclusion and references. The question still continues. What is critical care pharmacy? Tonight, we're going to understand it very well. We're going to understand who really is a critical care pharmacist and how to specialize in critical care pharmacy. I'll start by dealing with this scenario. This scenario will help you to understand what critical care pharmacy is all about. Imagine yourself as a critical care pharmacist at a large teaching hospital. Bring the word round, intensively, who may be a physician or a nurse, inquires to know these questions on appropriate infusion rates of IV nutrition for a dialysis patient that had burns up to 60% of his body, who is currently fluid overloaded. You're asked to help them get the infusion rates. Or a nurse may approach in the ICU and ask you about a septic patient with 2 central lines that they want to administer up to 4 different medications. They're not asking which of the drugs can be mixed together, which cannot be mixed, and even the rates. Are they going to be given as a bolus or as continuous infusion? They still ask you which, is it via wide site connection or what? As a critical care pharmacist, you're able to answer all these questions. So being able to handle complex clinical questions like this make me to understand that we are critical care pharmacists because we work in a high pressure environment. This makes you to be a specialist, an indispensable part of the critical care multidisciplinarity. So by way of introduction, critical care pharmacy is a subspecialty in critical care in clinical pharmacy. Basically, critical care medicine is still a new subspecialty in medicine generally. When you now bring it down to pharmacy profession, it's still a new subspecialty in clinical pharmacy. Specialized intensive care pharmacist was first established in the field of pharmacy in 1982. So recently, critical care pharmacy is a practitioner who has an expert level of competency in critical care pharmacy practice. The discipline of critical care pharmacy practice evolved over the years and now become an essential component of the multidisciplinary team in the critical care units. We pharmacists are required to work closely with other healthcare professionals in able to promote health, prevent disease complications, and as well as monitor medications, the use of those medications, the drug regimen, so that they should be used effectively for our patients to benefit in their humanistic outcomes, clinical outcomes, and even economic outcomes in such units. The major role of a critical care pharmacist is to provide comprehensive medical care to patients in the ICU. We call it comprehensive, holistic. Anything concerning pharmacotherapy is the duty of a critical pharmacist to render such services in the intensive care units. Now, critical care pharmacists are now recognized excuse me, as an integral member in the critical care team, along other professionals, which we are still going to enumerate as we go on. That was why in 2013, FIP World Congress took this theme, connecting to complex patients. Pharmacists takes the lead. They want pharmacists to really go into critical care specialization, to really take the lead in caring for such complex patients. That was the theme of FIP in 2013. especially in time 2013, affirmed that ICU is a potential area for drug therapy problems. The reasons we shall all know as we go on. Patients who are in the intensive care unit are very complex because they require extra amount of care. They require extensive medications. Such patient intensive care, you can see a patient in such an environment that is on up to 15 to 20 medications going in to a patient at the same time through different routes, and mostly through intravenous routes. You can see the reason why clinical pharmacists must be present in such environments. Up to 15 medications going into a patient at the same time. There are bound to be drug-drug interactions. There are bound to be incompatibilities in terms of different medications. Hence, the need to have a pharmacist in the intensive care unit. Also, coupled with their physical limitations, majority of the patients in the intensive care unit are unconscious. They cannot talk to you, so we need extra care to manage such patients. These are just the history, how critical care pharmacy began in the world. So that as far back in 1930s, the first ICU was formed. Pharmacy trainees attend patient care rounds. They started decentralized the pharmacy services between 1950s to 1960s. Between 1980s, 1990s, pharmacists started joining the surgical trauma and cardiac arrest teams. It continued to spread up to forming different arms of intensive care units. Pharmacists found themselves in such different ICUs, and an increase in the number of critical care residency fellowship programs, especially in the Western world, made critical pharmacy to come into stay. Then there was a joint task force by Society of Critical Care Medicine and the American College of Clinical Pharmacists. They developed position paper for specialization and board certification in 2000. That position paper is our term of reference. They express the services that should be rendered by critical care pharmacy in the intensive care unit. There were up to 3 parts. The first part is the fundamental services. We have the optimal services and the desired services. But as I'm speaking with you, we have a new position paper that came out in 2020. They just divided the service of the critical care pharmacies into 2 different groups: the essential services and the desired services, which we can discuss in subsequent presentations. Now, where are we in Nigeria? We've talked about how critical care pharmacies evolved in the world, in the Western world. Where are we in Nigeria? Do we have critical care pharmacy practice here in Nigeria? If you get Essentials of Pharmaceutical Care, the newest edition, edited by our Honorable Professor Azuka Opara, chapter 34 of that textbook, I wrote on critical care pharmacy, that start from page 70-something or thereabouts. I emphatically say that in Nigeria, critical care pharmacy practice is still in developing stage. We are coming up. And I'm happy that we are making this presentation today. And from tomorrow, next tomorrow, West African Postgraduate of Pharmacy here in Nigeria are starting critical care update lectures. So I'm so happy that finally my dream has come to pass. That critical care pharmacy is now a subspecialty in our faculty of clinical pharmacy here in Nigeria. So we started and we continue to move on. I just want to use the opportunity to thank the SG of our dear college for starting critical care pharmacy in our college. So few tertiary hospitals have ICU facilities in Nigeria currently. Those that have intensive care facilities do not have trained critical care pharmacists. That's a big gap for us here in Nigeria. And by the grace of God, in a few years' time, we'll be able to bridge the gap. I want to say that there is urgent need to have trained critical care pharmacists in our various ICU in Nigeria, tertiary hospital. Now, let us understand what we mean by intensive care units. Intensive care unit is a specially staffed, equipped, separate, self-contained area that is dedicated to the management of patients with life-threatening illness, injuries, and complications. They need serious monitoring of potentially life-threatening conditions. So this is the environment where you can practice critical care pharmacy. And stating this that because when we form our critical care specialty group, many of our colleagues join, they're happy that people, have interest to learn more about critical care pharmacy. I want to state that if you really want to specialize in critical care, you are going to work in intensive care units, or else the aim is defeated. You practice in critical care in intensive care units. As a pharmacist, we should have knowledge of critical care pharmacy, the basic knowledge. All healthcare professionals should have, so that you can easily refer patients whom you see that is critically ill back to a tertiary hospital where they have the facility of intensive care units. But if you really want to specialize in intensive care units, you must have that passion, you must have that vision, or you're already working in intensive care units, or you plan to work in intensive care units. In our group, we have so many pharmacists from NAIP, from ACPN, even those that work in primary health care. Everybody showed interest to specialize in this specialty. Fine. But I want to say that for you to write your board exams or to, enter to specialize in critical care in our college, that's the West African Progressive of Pharmacists, you should know that you ought to practice in intensive care units for you to get that experience training in order to pass such exams. Because critical care pharmacy is not just theoretical. After the theory, you must have to do experiential training in intensive care units. And we must have acquired such knowledge for you to practice it in intensive care units. So let us bear this in mind and choose where we want to specialize. ICUs are extra equipped units that provide highly specialized care to patients who suffer from serious injuries. You also determine to work in such environments with their specialized care. Patients come into the ICU from emergencies, that's the A&E, from other hospital units, transfer from other hospitals once that they have the need for ICU. In most cases, maybe they need support, they need support, respiratory support, maybe need of a ventilator so that they can breathe well and then manage other comorbidity conditions. It is served by highly specialized multidisciplinary team. Pharmacists play a key role in the ICU setting, managing these complex patients with various routes for the administration. They have what's rapidly shifting pharmacokinetics and dynamic parameters, and extreme physiological experience in critical ill patients. We have different critical care areas, different ICUs, like surgical ICU, medical ICU, cardiac ICU, and so on and so forth. In my center, which is the University of Nigeria Teaching Hospital, we have general ICU, where we manage medical patients, surgical patients, trauma patients, RTAs, and we have cardiothoracic intensive care units, where we manage cardiac patients that underwent open heart surgeries or other cardiac surgeries. We also have pediatric ICU, that will manage children. These are the basic 3 ICUs we have in my facility. Then in ICU, we work as a team. Then you see physicians who may be intensivists, anesthesiology, you see critical care nurses, respiratory therapists, critical care pharmacists, and the rest. Or they all work as a team just to make sure that the critical ill patients are managed very well to improve their outcomes. This is a typical ICU. You can see so many equipment inside this cubicle just for it to use to manage one patient. There is a ventilator, there is monitors, several other equipments which the pharmacist must be cognizant with. Because if you don't understand those equipments, you may not function well. Those equipment, the monitors help us to have informed decision on the clinical terms of our patients. They help us to make our interventions. So for you to work in such an environment, if you're able to understand those machines, what they stand for, and how to read them. This is a typical pediatric ICU. You can see these small neonates. This patient is receiving not less than 10 medications at the same time. You can see the infusion pumps. Hence, the need to have a clinical pharmacy beside these patients to monitor drug-drug interactions, identify drug therapy problems, identify compatibilities, and so on and so forth. So the pharmacist will be able to read all these machines around these patients, be able to interpret them for him or her to function very well in these units. Able to understand, this one is the monitor. You help us to see the patient heart rate, the blood pressure, the MAP, the CBP, the ECG. Immediately you read it to understand what's happening to your patient and the medications needed. So we should be able to understand what these things. The typical ventilator used to support our patient breathing and several other equipment. In intensive care units is a multidisciplinary team that works there. When you have a cardiac arrest patient, everybody is on ground to help that patient. Everybody starts CPR, whether you're a physician or a pharmacist or you're a nurse, you work together and you're able to understand it because you may be the person who will be to give the shock to the patient at any point in time. So we should be able to understand all those equipments in the intensive care and operations. Let's pharmacy services will be provided by a pharmacist who is specialized in critical care. And not only that, we still have other pharmacists that are not yet specialized who are still undergoing training. We all work together in the ICU. And we still have pharmacy technicians that help us in taking care of other non-clinical roles. The knowledge and skills required of a critical care pharmacist, you must have extensive knowledge of pharmacology, pharmacokinetics, and comparative knowledge of medications that are used in ICU. I still have typical drugs that you may not find in other wards, in other pharmacies, like Mirinone, adrenaline, phenylephrine, so many orphan drugs that you find in intensive care. So it's the duty of a pharmacist to get acquainted with such medications, their side effects, their doses, and everything concerns such medications, so that to give drug information to other healthcare professionals in such environments. You should be able to understand the pathophysiology of the, because patients who come into the ICU, all of them have so many comorbidities. You have a patient that has hemorrhagic stroke, secondary to hypertension, diabetes, heart failures. So you're able to understand those pathophysiology for you to really function very well. Yes. If you are able to understand the pathophysiology of a hemorrhagic stroke, you're able to know that this patient that just had this stroke came into the ICU should be given anticoagulation, and if the first or then at one thing is confirmed that no more active bleeding. But if you don't understand the pathophysiology of the disease of the patient, you not really help out work as a clinical pharmacist in such an environment. You're able to understand that equipment in ICU, the surgical procedures, because almost after surgeries in the theater, once there is a compromised respiratory distress, they always bring the patients into the So you should be able to understand such surgical procedures to help you make the interventions in the ICU. The pediatric pharmacist should be able to interpret labs and diagnostic results. It's crucial because in intensive care units, patients' labs comes out up to 4 different times in a day, and drug changes are done immediately. So you should be able to read the labs, blood gases, blood counts, electrolytes, able to read ECG, and so on and so forth, so that it help to make informed pharmacotherapy for our patients. Able to get to know technological advancements as the case may be. All this now to optimize pharmacotherapy using evidence-based medicine. Some of the services we render in intensive care units, medical history and reconciliation on admission, we should do that during discharge. We coordinate and supply medication because it's only when you supply your medicine that you can monitor. And we have zero tolerance to out of stock in intensive care units. I will review medication shelves prospectively, monitor therapies, and even indulge in therapeutic drug monitoring if you have the equipment in your facility. We provide medicine administration device in terms of IV compatibility, because so many IV drugs are being given to the patients at the same time. We have the enteral feeding tubes, medicine interaction, drug disease, and so on and so forth. Able to do those adjustments in renal impairment patients and also in hepatic patients. Frequency of patient review, patient complexity, different cases at the same time. That we indulge in pharmacy ward rounds and multidisciplinary ward rounds. Very, very crucial. But it's only during the pharmacy ward round that you have to do your patient, the histories, and able to identify the traffic problems and arm yourself with information and avoid the multidisciplinary one, where you can now usher in your observations, your assessment and plans for other professionals to reason along to bring out the best of care in terms of pharmacotherapy for our patients. We develop protocols. Pharmacists play a vital role in developing intensive care units, such as the antibody stewardship protocol, anti-coagulation protocol, sedation protocols, all guidelines that help us to work effectively in intensive care units. And those protocols will help you to determine the deviation from the protocols. It help us to identify problems immediately when they arise. It's ability to educate our staff, train other pharmacists, nurses, and the medics too. And as a critical pharmacist, we're able to prescribe students, pharmacy students, interns, and West African Pediatric College students that are doing their residency. And the main issue that you want to document all our activities. And from those documentation, you now use it for your research and publication. And so and so. This is a pharmacist ward round in my unit, multidisciplinary rounds. In this multidisciplinary round, I can see the cardiology there, thoracic surgeon, critical care nurses, pharmacists. So many professions are there in the ward round. That's where we tell them who we are when it comes to pharmacotherapy. The justification for us to have critical pharmacy specialization. After drug events occur in approximately in the hospital patients, and patients in ICU settings are at a greater risk in developing adverse drug events. The complexity of ICU, extensive medicine regimen treated in these areas create an environment that are more vulnerable to harmful patient outcomes when it comes to medication errors. And this study about improvement of a thromboembolic disorders, trying to x-ray what happened when there's a critical pharmacist in the ICU and when there is none, that the mortality of was increased in ICU patients with TIE without clinical pharmacy services when you compare it touch that have a critical care pharmacy services. That the billing competition increases by 49% more where there is no pharmacist in such environments. And the length of stay also were affected, and the cost of therapy. Significant difference between the intensive care unit that have the clinical pharmacist and that without the clinical care pharmacist. Studies have shown that a clinical pharmacist in ICU reduces mortality, adverse events, improve clinical outcomes, and reduces hospital costs. Hence, the need for us to really get a competency in order to affect the lives of our patients in intensive care units. These are the studies we did in our intensive care unit in my center. This one is assessment of drug therapy problems among patients in intensive care units of the Pediatric Hospital. It was a prospective study. We screened up to 462 patients in this study, and we identified 729 drug therapy problems. Drug interactions were the highest, followed by inappropriate drug selection, followed by inappropriate dose selection, and the rest. Our intervention, up to 92% of interventions were accepted by the prescribers. Only around 5% were, and they give us information, the reason why they should not accept just the 5%. And the majority of the problems identified were resolved. And we therefore concluded by saying that the drug therapy problems among patients admitted at the tertiary intensive care unit were high. Drug interaction and inappropriate drug selections were commonest drug therapy problems identified. Clinical pharmacists perform high number of interventions, and the level of acceptance was high. This is another study we did. The impact of multiple care in cardiothoracic ICU of our hospital. We screened 95 patients through prospective studies too. We identified up to 139 interventions with PTPs. It just at the cardiac ICU. And you can see up to 76% of total problems were prevented. 2% were closely monitored, and some were prevented. Up to 12% were all resolved. Okay, and the GRPs identified were among of them here. Drug choice, wrong drug choice, drug dosing, drug intervention, and we divided them into 3 different clinical levels of significance. 44% were potentially severe. We have moderate to around 18%, and non-clinical significant was just 2%. We want therefore conclude by saying that hospital care does have great impacts on patient care in the cardiothoracic ICU, and the presence of a clinical pharmacist is necessary for positive therapeutic outcome. This is another research we did. Go to the internet, you see them. The outcome analysis, where we now compare our services, anti-coagulation services managed by pharmacists. For the prospective study too, we screened up to 108 patients. The major corporates, anti-coagulation were offering for the highest DTPs, followed by HEP rate. We made it to generate the drug effectiveness of the therapy, drug interactions, adverse events, dosage issues, adherence, and wrong drug selections. The outcome was the majority of patients, up to some 8% of what we identified, were accepted and were all resolved. We therefore conclude by saying that anti-coagulation therapy of patients in ICU require precise dosing, monitoring, and appropriate patient education, so as to ensure that our patients are maximally taken care of. Therefore, clinical pharmacists have a vital role to play in intensive care units. How do we develop competency? How do we develop that competence and skills we need? And you have to acquire the knowledge, behavior, attributes. This can be gotten through education, training, and experience in intensive care units. We go into didactic lectures, and after that, we must have to get a special training in intensive care units. So the credentialing and qualifications of a critical care pharmacist, with our basic B.Pharm or PharmD, with our masters and PhD, we still need to, like I said earlier, the WAPC now have a critical care pharmacy specialty in the Faculty of Clinical Pharmacy. Kudos to our AG. And after that, you have to do residency in intensive care units for you to get the special training. Also, you can do that through certification, like what is occurring in America, US board specialty certification in intensive critical care. After you must have practice experience in intensive care units. This is my humble story. After my training in US, I came back, started doing an impact, practicing as such as a critical care pharmacist, and then I was called upon to write what we are doing in our center. So I wrote what we are doing, and before I know it, it was published in FIP newsletter June 2018 with this caption: Africa official critical pharmacy in Nigeria. So I put on all of us to go into critical care. If you have that passion for it, make an impact in your hospital for our pharmacy profession and for our patients. This is an era that we need to completely rethink our approach to creating value and specialized services to our patients. A time for new possibilities, a time for collective ambition. I thereby conclude by saying, critical pharmacy is a new subspecialty in pharmacy practice. Critical pharmacy must be dedicated in ICU. That's where you practice critical pharmacy. You cannot practice critical pharmacy in your community pharmacy, in the academia, or in the night. You can teach people, fine, but if you want to practice critical pharmacy, you want to do that in intensive care unit, where you have the equipment, where it will be a multidisciplinary approach. And you must have the education. Start with our college, our Western Political College, get into critical care pharmacy subspecialty, and still have your practice experience in intensive care, which is the key to returning to critical care pharmacy. Be not afraid of going slowly. Be afraid only of standing still. Make a move. We shall all get there by the grace of God. For further reading, I encourage us to read Essentials of Medical Care, second edition, written by our Elpo Professor Azuka Opara, chapter 34, with the caption of that chapter, Critical Medical Care, written by my humble self. You can get more information on critical care pharmacy. Thank you for your utmost attention.
Thank you so much, Dr. Morin, for you have done so well for us this night. You've digested the intricacies of critical care pharmacy, the requirements, what critical care pharmacy is about. I'm sure many people have actually been wondering, even those that have joined the group have been wondering what critical care pharmacy is about, what the roles of the pharmacist is in critical care and all. So I'm very glad we had this presentation today, and I thank you so much for making it so easy to understand. And I'm sure that many colleagues here will be able to make a complete decision on if they want to do their residency in critical care. But for those that are already practicing and that have experiential practice in critical care, they would now be able to concentrate more towards preparing for their board certification exam, so at least they can get certified as critical care pharmacists. And this is actually an eye-opener that there's a lot the health profession in Nigeria needs where pharmacists are concerned. Most hospitals have to start opening more spaces for pharmacists in these specialty fields. And a lot of patients have a lot to benefit from the role of pharmacists in these different specialty fields, especially, as you've mentioned, critical care pharmacy. Patients in the ICU need us there. So it would be nice if many pharmacists are able to get certified as critical care pharmacists. Thank you so much, Dr. Maureen, for that concise presentation. So we welcome more members that have joined since the beginning of this presentation. Thank you all for joining us. So we'll be taking the question and answer session. If anyone has any question or any comment or any contribution to what Dr. Maureen Nwankwo has already presented, you're welcome to unmute yourself and ask your question or make your comment or contribution. Any questions, comments, contributions? Do I take it we've all understood what critical care pharmacy is about and we don't have any questions for our presenter today? Or at least contribution or comments? Okay, I can see Pharmacist Nwese Babalola raising his or her hand. I don't know if it's a male or female. Please, can you go ahead? Okay, female, please, can you go ahead and ask your question or make your comments or contribution? You can unmute yourself, please. Pharmacist Nwese, please unmute yourself and make your comment or contribution.
Since she cannot unmute, please can Dr. Bello help us? She's unable to unmute herself.
Dr. Bello, can you help to unmute Pharmacist Nwese?
Okay.
Okay, hello. Hello.
Okay, we can hear you. Good evening.
Yes, good evening, everyone.
Good evening.
Yes, I really want to thank Dr. Maureen Nwankwo for that awesome presentation. I want to really appreciate that she has really touched very pertinent points in this presentation. It's more like our inaugural, presentation in critical care, and I'm glad that she has taken the bulls by the horns and been able to give us a wonderful presentation this evening. Dr. Maureen, we really appreciate you for that. Yes, I've barely met with her, maybe just like some few weeks ago, and in relating with her, I know that she has a lot of stuff, and all that, and she has really shown this evening that indeed the stuff is there, and we've heard everything she has said, and we are all maybe involved in one critical care unit or the other, and we know that for everything she has touched, she has said actually what happens in the critical care unit. And it's more of a clarion call for us to arise in every area of where we are, and rise up to help patients, because working in a critical care unit, you will indeed see that you have a lot to contend with. First of all, you enter a critical care unit, the gadgets alone make you feel like, wow, what is this? And all that. And then you now have patients struggling to leave. You're now trying to ask a lot of questions, and you are trying to find out, you're contending with this gadget, you're contending with a number of drugs. You would all agree with me that you have more than, in fact, sometimes close to 20 drugs to contend with on a particular patient. And the question is, how do I go about this? How do I add value to this patient? How do I do it in such a way that this patient is not, does not go under? Instead, the drugs are adding value. Like I always say, medicines are supposed to add value to patients. That is the intent. They shouldn't even bring patients under, but we now discover that these things that are supposed to have added value to patients are now causing more harm than good. Now, our specialties were coming in to say, how can we help? I would say that it is an evolving a specialty, but that is where it looks like we all need pharmacists from all over to be able to, because that's where we are. We are saying that, okay, we are specialties and we want to see that patients receive that drugs add value, not harm, do good, not harm to patients. So let's not take it with kid gloves. Let's put all hands on deck. Let's share knowledge. Let's see how, if you're making it in that area, please share knowledge with the other person that doesn't have as much as you have, so that we can see together, as men of honor, we join hands to ensure that the healthcare system is lifted high, even in this, in our own niche, and all that. The doctors have it all. They're there. When you see the way they come together and they do things, you are like, wow. If we can also come together from every corner here and there and have our own niche and add value to the patients, would have done a lot of good to the health service in Nigeria. So I implore us all, she is taking the lead, and let's also see how we can share knowledge and make life better for our patients. Thank you so much. And Dr. Maureen and Wafo, I really, really appreciate you. And I'm coming after you, like I have told you.
Thank you. You're highly welcome.
Thank you so much. You did a very good job to topic this day, and God bless you, ma'am. Have a very good evening. Good evening, everyone.
Good evening. Thank you, Dr. Mwese, for that contribution. Okay, before we go on to the next hand that is up, I have a question from Pharmacist Okpeyemi Adebusola. Pharmacist Okpeyemi wants to know from Dr. Maureen. Pharmacist Okpeyemi wants to know if a critical care pharmacist needs to specialize in a particular area. I'm not too sure what that question means, so I don't know if Pharmacist Okpeyemi is here. Can you please unmute yourself and be clear on your question? Can you clarify your question, please? Do you want to know if the person has to specialize maybe in cardiovascular, critical care area, or pediatrics, or let's understand your question.
That's what he meant.
Okay.
Yes.
Dr. Maureen, over to you.
Okay, thank you very much for this question. We here in Nigeria, we're just starting critical care pharmacy, but where
Ma, are you still there? Ma, are you still there?
No, she's no more on the call. I think she had okay, she's there. She has a network challenge.
I guess so.
Yeah.
Dr. Wafo.
She has been thrown out of the. Okay, she's back. Yeah, she's back. Yeah. Can you unmute yourself, Dr. Maureen? Can you unmute yourself, Dr. Maureen? Yeah.
Okay, welcome back.
Thank you, Mike. As I was saying, yes, there's need to specialize in a particular intensive care unit, like pediatrics, medical ICU, pediatric ICU, burns ICU, trauma ICU. We get such in developed world. Yes. So for us here in Nigeria, we are just starting. So I encourage us to just get into critical care first, get the knowledge of critical care pharmacy in your institution. Then you have the basic knowledge of critical care pharmacy. Like in my own institution, we have just general ICU, pediatric ICU, and pediatric ICU. So in general ICU, we see trauma patients, surgical patients, medical patients, and so on and so forth. So we've not reached that era anywhere. But myself, I narrowed my own down to cardiothoracic ICU. But still, I still have that basic knowledge for other part of ICU. So we'll start from somewhere and we get there. So it's possible to narrow it down to a particular type of ICU. I think I've answered that question.
Okay, thank you very much, my Pharmacist Okpeyemi. I hope you're clearer now. Okay, I'll call on Pharmacist Rosemary Nnamani. Dr. Bello, can you help unmute Pharmacist Rosemary Nnamani so she can ask her question?
Okay. Okay. She can go ahead and unmute herself now.
Pharmacist Rosemary, kindly unmute yourself and go ahead and ask your question.
Yes, thank you very much, the moderator. Hello.
We can hear you. Hello, are you still there? Pharmacist Rosemary.
For presentation. Hello. Thank you very much for that wonderful presentation. Yes, my own is comment. You are my mentor.
Hello, are you there? It seems Pharmacist Rosemary is having some network issues. Pharmacist Rosemary. Okay, it seems she's no longer here. Okay, while she's trying to come back online, let's call on Pharmacist Olumuyiwa Ogunlolu.
Thank you very much. Yeah, you're right. Thank you very much, Dr. Maureen. If you remember, yesterday we spoke. Hello, can you hear me?
Hello,
Yes.
thank you very much.
Hello. Hello, okay. Thank you very much, Dr. Maureen.
Hello, can you hear me?
Pharmacist Rosemary, it seems you were caught up before.
Hello.
Pharmacist
Can you hear me?
Pharmacist Rosemary, if you can hear me, it seems you were caught up before.
Okay. Yes.
Yeah. Can I go ahead?
Okay. Thank you. Okay.
Pharmacist
yes,
you
go
have
ahead.
the floor now. We'll call you.
Thank you very much. Thank you very much. Dr. Nwafo, thank you. I think when you came on in Port Harcourt, you know, it was so fascinating seeing you. And I think we spoke this morning or yesterday, and I told you that was when I met you. So good one. What I just want to find out and contribute is, number one, the residency program in West African Postgraduate College. When is it kicking off? Just to reiterate it again. Then again, what do we do to be able to get in? Then I also want to offer advice in taking it, just like when we took PharmD. You know, then PharmD, what they did was when you want to do your internship or hospital experience, they have some affiliated hospitals then that you can go to. Like you'll find out that it's not all the hospitals where we work that has this critical care, that's ICU. So it will be good wherever we are practicing this, when West African will be starting it, to affiliate with a particular hospital in order to boost people's interest. Because by the time you want to say, oh, if you have it in your hospital, then you can come for it, we may not really have people develop interest in it. So let us look for a way where we partner an hospital around where we'll have it. Or people can be asked to go for internship wherever you choose, where they have preceptors. And then, so I just want to know, when is this starting? So that, and then how will it be easy, or how will it be made possible for people to easily get in and do it? Because it means arousing our interest in it. Thank you very much.
Okay, thank you very much for that question. Dr. Maureen, please, can you help clear the answer, please?
Thank you, my dear, for this question. We spoke earlier today. Okay, for your question, yes, WAPC have started critical care subspecialty in the Faculty of Clinical Pharmacy. Actually, from tomorrow, there will be an update lecture for Part 2, Level 3 students. And critical care pharmacy is one of the lectures that will be given from tomorrow. So it has started, and the intention is that during the residency time, the students will now find themselves in different hospitals that have preceptors that can help them have that experiential training in ICU. So that's how they fashion it out. So it has started by the grace of God. And
sorry, man, just a follow-up question. For people that have done their West African for quite some time, how do you get in to now do it?
Okay, fine. The college said that there will be they will have to, start certification program again for those already finished their fellowship program. So, but it's still coming. I don't know when they're going to do that one. So all old students who won't have interest to specialize in critical care will come in for a certification program. Yes, they are still planning it. But for now, what we have now for those who are still in the college, very soon we will start for old fellows. So it's in pipeline, sir.
Thank you very much, ma'am.
You're welcome.
Okay, thank you very much, Dr. Maureen. Pharmacist Rosemary, you have the floor now. Can you ask your question? Unmute yourself, please, and ask your question.
Hello.
Yes, Pharmacist Rosemary, we are here.
Good evening, all.
Good evening.
Good
We can
evening,
hear
all.
you. Good evening.
Thank you very much, Dr. Murray, for that wonderful presentation.
Hello. I want to say that Mrs. Rosemary Naman is my pharmacist. She's working under me in ICU here in our institution.
Okay.
I'm glad to say that I've mentored a critical care pharmacist. She was employed into our facility far back 2013, and I don't know how God made it. She was posted to ICU. And from that particular day, 2013 to date, nobody has posted her out of ICU. She had that passion for critical care and making great impact there. She's my baby. She has learned a lot, and I'm proud of her. I can say that even if I'm not in our ICU, And once Rose is there, I'm covered. I'm good to go. So thank you, Rose, for having humble yourself to learn. And she's just waiting to be satisfied. She's for experience and everything. She has all of it. I'm happy to have her as my pharmacist in 2020. So Rosemary, thank you very much.
Okay, thank you very much, Ma. It seems she's having a network issue.
Exactly,
so
exactly.
I've sent a chat and I hope she can see the chat. I will need to take the next
Thank you
question.
very much.
Okay, so the next
Dr.
question is from Ali. Pharmacist Ali wants to know the role of pharmacists in total.
My doctor.
Pharmacist Ali wants to know the role of the pharmacist in total parenteral nutrition in critical care. He wants to know if total parenteral nutrition is the job of the dietitian or dietitian with the pharmacist or the pharmacist alone.
Okay, that's a very good one. Pharmacists, we have a great role to play in total parenteral nutrition. Actually, it's a teamwork. We need to collaborate with the dietitian, with the nurses for us to give this service. But actually, the center of the center there is the pharmacist. You know, it is our duty. You know, when we continue to go into this specialty more, we find that we have a great need for us to assess our patients' nutrition. And when we find that, especially those that have a compromised GIT, then there's need for total parenteral nutrition. It's really the pharmacy that have to assess these patients and go ahead to prepare such. In my center now, we don't have the machine to prepare the TPR, TPN, but once we assess a patient and we find that there is a need for TPN, we always make sure that our physician prescribe, because it's only when they prescribe that we can go ahead to give. So they prescribe, and for now we are using premix TPN. So you know, in the TPN, there's need for us to know our patient electrolytes, the potassium, the sodium, the electrolyte, the calories. So it is the job of a pharmacist to do those things and to calculate the exact dose, exact quantity that is needed to make up the total parenteral nutrition in collaboration with the dietitians and other healthcare professionals. But actually, it is the role of the pharmacist to start total parenteral nutrition. In our center, we've already started, and by the grace of God, one day we may get the machine so that we can mix it as we need. So right now, we use premix, but we still achieve the aim of giving our patient total parenteral nutrition. Thank you very much.
Thank you very much, Dr. Nwa. For Pharmacist Ali, I hope your question has been answered thoroughly. Okay, so I can see Pharmacist Funsho. Pharmacist Funsho's hand is up. Please, can you unmute and ask your question?
Okay, thank you very much, everybody. I hope I'm clear and loud.
Yes, yeah. Clear, loud
All
and
right,
clear.
Okay, loud and clear. So I want to join my voice with others to say a very big thank you to Maureen for the presentation, and is the outcome of passion and vision. And this is an encouragement and challenge to others that just locate your niche and strengthen yourself there. And sequent to that, I want to make a contribution to one of the questions asked. You're already a fellow of the college. Now, how will you fit into critical care, for instance? You don't even need to have to wait for the certification program. What you have to do is to get to the closest institution to you and submit yourself for mentorship and residency, privately. You don't have to wait for the college, because some of us now back in the college as guest lecturers, not just because of what you have from the college, but personal efforts like Maureen in strengthening yourself in areas where you have interest in. So the pharmacist that asked that question, you don't need to wait for the certification program in the college. You yourself can move close to any center close to you, or you come over to UNTH. We are ready to welcome you for mentorship. Take some time together, and then you start practicing it. And then your institution, maybe your posting should be, you find yourself in such a unit that you have interest in. So it's practice, keep practicing where you are, you strengthen yourself there and become an expert before you wait for paper certification. So that's my suggestion. And for the moderator tonight, thank you very much for the good job you are doing. Thank you all and God bless you.
Thank you very much, sir. Dr. Onwese, I can see your hand is still up. Do you still want to say something, or it's the same one that was up before? Dr. Onwese, are you there?
Hello, yes, okay. Good evening again, once again, yes. I want to maybe add a voice to that residency thing we're talking about. Like Dr. Maureen said, critical care is a practical thing. It's not theoretical at all. And yes, updates, we're having the head knowledge and all that, but the practical aspect of it. Now, how many institutions are ready to take in? Because that's a very important point. You can't just go to a critical care unit and say, oh, I'm here to learn or to have the experience. The management has to accept you into the facility to be able to do that. Now, what is college doing about it? Because I remember when I did my own residency, people had issues of attaching themselves to facilities where they could practice to do residency, and all that. Some people were not accepted into some facilities and all that. And I also know that not every hospital is ready to take in. So is the college making efforts to see how many of these facilities will be willing to take in, students, to mentor them and for them to have hands-on, to put their hands to this and all that, because that's one thing. We can do updates and they have the head knowledge, but then practically, are there sites where these people can go to and management of those facilities will take them in to be able to, practice and all that? Because that is very, very important. Because after the update, the next thing is getting practical. And if that is not sorted out now, then we'll have an issue of people having the knowledge, but then not being able to practice what they have. Are there efforts or things in the pipeline to ensure that students from the college or people that are interested in submitting themselves to this to this area of practice have access to those facilities with no issues?
Okay, thank you very much, Dr. Onwese, for that question. I think it's also linked.
I'm not a doctor.
It's also linked. Hello?
I'm not a doctor.
Oh, okay. It's also linked to the, like Dr. Madu will say, all pharmacists are doctors, but it's not an issue. It's also linked to the next question we would have taken from the chat. The person says that in her facility, Pharmacist Upoma says that in her facility, joining the medical team for rounds is usually not welcome, that the medical doctors and pharmacists strife is still there. How can they easily access the ICU and be trained? So I think it's linked to the last question by Pharmacist Onwese. So Dr. Maureen, I think both should be taken together.
Okay, thank you very much. The last question, a facility, they have intensive care units. The pharmacist asking this person, is she working in the ICU in that facility and she cannot do rounds with the physicians? I don't know. But
No, for me,
yeah.
Sorry, doctor. Yeah, in my own facility, there's access, right? I go on ward rounds. I go on ward rounds with the doctors. I can also do my ward round. I don't have an issue with that. But then there are some facilities where, and these are few. Okay, so if you talk about my own institution, we talk about your own institution, just like two. Not all would accept, just like that. The last person said, in her own facility, they are not allowed to, go on ward rounds. There's still that beef, and all that. So if you have so many, and I know of many that still will not give access to pharmacists. Yes, they have the facility, but they will not give access to pharmacists to carry out their ward rounds and all that. So we have just very few, which will make it a lot very difficult, because if you tell someone in Lagos to go down to Enugu, that's a lot for the person. If you tell someone in Port Harcourt to come down to Lagos, that's a lot, and all that. It's a lot easier when you have it around you. You can easily pop in, and do what you have to do and do. So that's why we're asking, is there anything in the pipeline to see that these facilities are made accessible to people all around, so that there are no issues of I'm not able to enter a facility?
Okay, I know that some time ago, the college through the Ministry of Health or so issued out circulars to all the tertiary hospitals to allow pharmacists access into their institution to do their residency. That letter got to my own institutions, and I know that other institutions must have received such letter. So it's not led for the pharmacists to make sure that they bring out the letter and go ahead and meet the management to really inform them the need for them to allow pharmacists. And but also, if there's any hindrance, they can say call up to the SG of our college, the PCN, to intervene. And I hope once they're aware that there is such approval, access to be given. Thank you.
Okay, thank you very much, Ma. I hope the question has been answered. Pharmacist Nwese, are you okay now with the response given? Hello, are you there? Okay, thank you very much, Ma, for such an
I am. I will speak with her more. Dr. Murray, we will talk more on that, but
No
for now,
problem.
I'm okay with the answer.
Okay. Thank you very much.
Well done, moderator.
Thank you very much, Dr. Maureen Nwa, for such an awesome presentation. Thank you to all the participants who made it possible for us to have this meeting today. I say thank you to CPAN for creating the specialty groups, of which critical care is one of them. And most importantly, I say thank you to the desk officers, Dr. Maureen Nwafo, who is our presenter today, and Dr. Timi Pre Okerogene, who is here today. She's one of the desk officers for this platform, and both of them have made it possible for this meeting to hold. And in the next few days, I'm sure a proper course will be charted for the way forward for critical care pharmacy specialty group under CPAN. So presently, I would like to call on Dr. Timi Pre, if she's still online. Dr. Timi Pre, can we have a word or two from you?
Thank you so much, Dr. Obiaguru, for this wonderful moderation. We are very grateful. Thank you so much, all our wonderful participants tonight. And thank you so much, Dr. Maureen, for actually accepting to do this presentation for us. We have said that from the record so far, we have 2 certified pharmacists in that group now, in our critical care group, and we have 3 certifications in view. So we are hoping that from time to time, we shall be having this kind of presentation. Next week, next 2 weeks, Thursday, by God's grace, we'll come up with another presentation that is going to be following up this one that we've done today. We have said it all. We have to be critical care. It is not anything theoretical. It is strictly practicing. You have to be there on ground. So we have, we call it a challenge. We have few people in that group that are from the industry, community, academics, and we are wondering. That's why if you notice the data that I actually was compiling, I try to spell out those that are in the hospital setting. So when you say are happening, I am not sure if it is administration. I just leave it that way. But if I know you, or I see that person practice, or the person tells me where he or she works, I put it hospital, because we see that we actually focus on those that are in the hospital setting more than other technical groups. So we are going to be putting up from time to time updates. And I think Dr. Maureen was even telling me of some email that she got, because she's also a registered critical care member. So I don't know, maybe with time she may be posting all those emails. You may need to register, and then what does it take? I'm so happy to even hear that West Africa has not started to offer it. So we may not be spending that much that we had from Dr. Brian when he talked about $600 or so for the board certification. We want to bring in what they are doing over there down here in the Nigeria setting, so that we do not want to have a certificate that will not make us start to wonder whether it will be recognized. Thank you so much for this wonderful presentation this night. And I want to also thank the moderator. So thank you also, Dr. Maureen.
Okay.
Very much.
Thank you very much, Dr. Timi Pray. So I think we have finally come to an end of this meeting. It's been an awesome time. It's been an enlightening time, and we believe that the next few weeks we'll learn more, either on the platform or in the next clinical meeting that we are going to have. So I think I would say till next 2 weeks, we'll see you either on Zoom, or in the next couple of days, we'll keep on seeing ourselves on the WhatsApp platform. So I also want to recognize the presence of Dr. Regina James. She's the CPAN Vice Chairman of the Education Committee. Dr. Regina James, you're welcome. Can you please help us with the closing prayer? Dr. Regina James, are you there? Can you help us with the closing prayer? Kindly unmute yourself. Ma, are you there? Okay, it seems she's not with us right now. Okay, can Pharmacist Ngozi Ironkwe help us with the closing prayer?
She's my elbow head shodio. I didn't know that she's here. Good evening. Thank you for joining us.
Good evening, everyone.
Good evening, ma.
Okay, let us give you in Jesus' name. Amen.
Amen.
We thank you for the beautiful time. Thank you for the milestones that we're covering in pharmacy. Lord, we are happy. Want to commit ourselves in your hands, oh Lord. The sky is not a limit beyond the skies. We're asking you, Lord, for each and every one of us, that you will the more, that will enable us the more. You will understand the will and patient care will become better and better. It can be a lead recovering. That it be removed. We'll fly our next point. For the presenters today, for the people that asked questions, and for each and every one of us that participated. We ask also help people not just to be part of it. Please make us that let's pray for some of those issues with them. We don't know. Nothing is as beyond the station. Bless and go. Bless the better. That's the very wonderful. Thank you for Stephen. Even in Jesus' name, we have prayed. Amen.
Amen.
Thank
Amen.
you, ma'am. Thank you for your support and the
Thank
learning environment.
Okay, so
thank you very much.
yes, so the meeting has finally ended. Good night.